Good morning, Dr. Hotinki and my fellow colleagues. Today, we are from Group F are going to present about the topic Clinical Protocol in Cementing Full Ceramic Crown using RelyX U200. Now, before we go into the details, let us talk about RelyX U200. Now, this product has an enhanced bonding strength to dentin, enamel, and restorations. It comes with high color retention and long-term stability. With its reliable 1-to-1 dosing, it comes with easy mixing and handling. It will produce excellent results and it does not require any tooth pretreatment. An interesting fact is that as compared to other multi-step resin cements, RelyX U200 is not time-consuming. Let's move on to long-term stability. RelyX U200 by nature is an acidic and hydrophilic upon application. Now this product becomes neutral and hydrophobic after setting. As a result, RelyX U200 can resist water uptake and therefore it remains more stable over time.
So now we look at the pre-treatments of a different restoration. For metal, zirconia, and aluminium oxide ceramic and composite restoration, we will first blast the restoration, which the internal surface will be luted with aluminium oxide. So aluminium oxide is a common blasting media. It has great strength and durability, and most important, it is lower cost. So the aluminium oxide is an ideal choice of abrasive blasting for surface preparation. It is cost-effective blasting abrasive because it can be recycled and can be reclaimed for multiple passes in blasting process. So after we blast, we will clean the blasted surface with alcohol, then we dry it. So for etchable glass ceramic restoration, first we will use hydrofluoric acid to etch the glass ceramic restoration. So why we use the hydrofluoric acid? Because the hydrofluoric acid is the most effective ceramic surface etchant. It can provide reliable bond with composite cement. It can cleanse the bonding surface by removing unwanted oxide, debris, and grease. And it can increase roughness, increase bonding area and wettability of ceramic surface. It can also create micro-retention, like micro-pore, groove, or channel that can be easily infiltrated with the uncured flowable composite cement. And all this together, it can increase the resin ceramic bond strength. So after that, we will rinse thoroughly with water for 15 seconds and we dry it. Next, we will apply an appropriate sealant. So sealant is actually a bifunctional agent that promotes chemical interaction between organic and inorganic components. It can also enhance bone strength. So for glass fiber reinforced posts, so we will first clean the post with alcohol and we will dry it with water-free and oil-free air. So that's all for my part. I will pass it to my friends for further explanation. Thank you.
For the next part, I will explain on how to check fitting of the crown prior to cementation. First, after checking the crown on the cast, we need to check the crown on the tooth. These are the steps to check the crown on the tooth. First, we need to check for any retained temporary cement or any trapped gingival tissue. If there is any, then we need to remove them. Second, we need to check the proximal contact between the crown and adjacent teeth to see whether there is any tight contacts that prevent the sitting of the crown. For the third step, we need to check the original cast for any damage to stone in proximal areas. Fourth, we need to check the crown for any lab errors such as casting blebs, gross overextension, damage or chipped dies. For the last step, we need to identify the binding of the crown to fitting surface using disclosing wax or aerosol sprays. Next, we have to assess the seated crown by systematic approach, which includes proximal contacts, marginal fit, aesthetics, and occlusion. Now, I will explain each of them. For proximal contact, we can assess it by flossing. We can also adjust using articulating paper. If there is any open contact detected, the crown needs to be sent back to the lab to add porcelain or gold solder. For marginal fit, it will be poor if there is any gap between the crown and the prepped tooth. It can be due to positive ledge, which caused by overhanging, or negative ledge, which caused by deficient of material. For aesthetic adjustment, we need to assess the shape and the shade of the porcelain, whether it complements the aesthetic of the dentition or not. For occlusion, we need to check whether the occlusion is too high or too low by using shim stock. Then we can adjust the crown with large diamond flame burr. It is advisable to be extra careful when adjusting the restoration to avoid perforation. For the next step on checking fitting of the crown prior to cementation, we need to assess the posterior teeth using shim stock. For this, we need to rest and adjust the teeth and hold firmly. Next, we need to assess the anterior teeth using shim stock. For this, we need to hold lightly to prevent tooth overloaded, pain, or any displacement. Last but not least, we need to polish the crown. This is because rough surface will rapidly wear the opposing teeth.
For the crown preparation for zirconia, first step is sandblast the surface to be cemented with 30 or 50 micron aluminum oxide at the pressure of 2 bar or 30 pound per square inch to create a matte surface appearance. Second step is clean with alcohol and air dry with oil-free air. And if sandblasting is done in laboratory before try-in, clean the saliva contamination with 5% of sodium hypochlorite and rinse with water. And make sure does not use phosphoric acid for cleaning. While for crown preparation for lithium disilicate, the first step is etch the fitting surface of glass ceramic for 20 seconds by using 5% of hydrofluoric acid. Rinse thoroughly with water for 15 seconds and dry it. Next, for tooth preparation, first step is isolate the tooth. It can be done by using rubber dam or cotton wool isolation. Second step is remove the provisional restoration and clean the pipette tooth using the pumice paste. And make sure there is no any residual left, and do not use hydrogen peroxide, ethylene diamine tetraacetic acid, or sodium bicarbonate. And the third step is rinse and lightly dry the tooth. And leave the tooth surface moist and do not over dry it, as it can lead to post-operative sensitivity.
The next one is crown cementation using RelyX U200. So for zirconia and lithium disilicate crown cementation, the first step is to apply the cement and seat. For clicker delivery, dispense a small amount of RelyX U200 to ensure even dispensing. Discard this material, then apply 2 clicks of the RelyX U200 paste onto a mix pad and hand mix with a spatula until a homogeneous mix is obtained. Wipe the clicker barrels to avoid contamination of the material and premature setting, and ensure that the cap is put firmly in place. The tips is 2 clicks is needed for a crown. For auto mix delivery, dispense a small amount of RelyX U200 onto the mix pad to ensure a perfect mix, then discard this material. Next step, for clicker delivery, use the mixing spatula to apply the cement onto the crown. Meanwhile, for auto mix delivery, dispense cement directly into the crown. Then, seat the crown firmly using finger pressure and then clean up. Step 4, light cure 1 to 2 seconds per surface and remove excess cement with a scaler while holding the crown in place. Do not exceed the recommended light cure time to avoid difficulty in cleaning up. And the last one is final cure. Light cure for 20 seconds per surface or wait 6 minutes from the start of mix for dark cure. Finish and polish as needed. Then finish the crown.
Next is about shaping. Shaping occurs after polymerization. There is 3 steps. First is shape any remaining uneven area on the edge of restoration and polish the margin area with diamond device, aluminum oxide coated disc, and diamond polishing paste. Step 2. Check on occlusion. that whether it has achieved a balanced occlusion. Step 3. Check the sulcus of the treated teeth and surrounding area to make sure any cement residue that are still remaining are removed, especially when cementing on implant abutment.
That's all for our group presentation. Thank you.